Hey everybody, this is Nelson Smith, Commissioner of DBHDS, and we're back with another episode of Conversations with Commissioner. And today we are joined by Christine Matthews at the Southeastern Virginia Training Center, where they are doing amazing things, and so we want to hear what those are. And so what do you do here?
So I'm Community Services, Community Relations Volunteer Services Coordinator. I have the pleasure of working not only with the individuals, but with our staff and our community here in Chesapeake. I reach out to the community for donations, for help, however we need here. And then with the individuals, I get to work with them on a daily basis as well. I get to see them. I take care of their birthdays. I have the fun stuff. I have the fun job. Yeah. When their birthdays come, we get to celebrate it with gifts. And then Christmas, all the good stuff I get to do here. I also have the pleasure of working with our staff here. So I'm a little bit of everything. Yeah.
And so for those that are watching, they don't know what goes on here. How would you describe what goes on at SCVCC?
So we here, I feel, are like a little community neighborhood. We're a 24/7 facility. We have 15 homes where our individuals reside in. We're pretty much self-contained. We have our medical, our psychology. We have a day support program that the individuals come to. Each day they have an opportunity to work on employment, money skills, a whole lot of stuff, but we also go out into the community. So we are just, we're our own little neighborhood here in the community.
Yeah, you would say you're the storyteller. You tell the stories to the community about all the awesome things that go on here.
I do, and I invite them to become part of our little community, because a lot of folks, when I started this, really had no idea of what is Southeastern. We don't know. Right. Well, they said, come on over and meet us. You know, come meet our individuals, come meet our staff, and get to know us. We are part of your community. Right. So they have, and we've grown by, word of mouth. Oh, hey, do you know about Southeastern? And so we've grown a lot with community organizations and folks helping us out here. And right. I've brought in the food trucks now, so that's kind of become a word of mouth.
Cool. Yeah, it's interesting because even when I learned or heard about training center, it doesn't really tell you what actually happens, does it? Training right. center.
Right.
But just for those of you that are listening, like, it's really cool when you come down here. You got to experience it. It's like a neighborhood. It is a neighborhood. Yes. Individual homes, 3 to 4 bedroom homes. I mean, it's like you could live here. And they drive around in golf carts, and it's just really, really special. Is that about right?
Yes, exactly, exactly, sir. And it's everyday living. They have an opportunity for life skills to learn. We also go out in the community, outings on the weekends and evenings. We have events come here, music events, petting zoos. We've had all kinds of good stuff.
Yeah, I actually saw a garden on my way in here. I mean, tell me about that.
So that was a dream of Miss Heather's, our CEO here. She had a vision. Mm-hmm. And so we have a very talented person on our building and grounds who said, well, I can put that together for you. So it kind of became a community garden that we implemented. He came up with the plans. Miss Heather approved it for us. It's 6 beds right now that we have. They're level so that the folks in the wheelchairs are able to come. And if they want to, when we get started planning again, they can join us. We have arches that join them, so as they walk through these arches on their way on the sidewalk, they get to experience a lot of sensory stuff. Yeah. It's visual, they get to see the plants. It's hearing because we have wind chimes and different stuff up there. So yeah, it's late, but we had a pretty good season. We were able to put in melons and different things. And
Yeah.
so it's a project we're working on. It's growing. We're coming up with different ideas, but
I built a garden at my house, was it last year? And so I completely get, like my 4 little kids, it's really cool to watch them see how these things happen.
Yeah.
But it was really rainy this year. All the tomatoes we planted just died.
And can I just say, I'm not a gardener. I'm happy to, hey, I'll get you some help to get this done, but don't put me in there, you know.
Yes.
But so I had the help of doing that. But then our staff and our individuals were coming over, and they're like, "Wow, this is really neat."
Right.
So again, it became just a great community project that we will continue to grow on. We've got ideas.
Good.
Yeah.
Keep them coming.
Oh yes.
We like new ideas.
Yes.
I always say, I tell our leadership team, is that, you know, and this goes for the agency, we don't want to make old mistakes. We want to make new mistakes. And that means we have to push the envelope on new things. So you say you don't have a green thumb.
No, sir.
But I do hear, and I saw that you have a secret talent. Did I see you in a chicken suit?
You did. You did. So the whole chicken suit outfit started, you know, like I said, we do events here, and it was during the Easter time. And I said, hey, how about we don't have a bunny, but we have this chicken suit, so it's a yellow chicken. So we did. One of our staff that is no longer here, but she was amazing. She got in the chicken suit. Yeah, I'll get out there and do it. Of course, I think we shocked all the individuals and staff at first, but then everybody was like, what a cool idea. So I kind of took it from there, and I started like different events that we had here. Well, would you wear this? Would you be Alice in Wonderland? Would you be the Mad Hatter? Hey, would you be a pink bunny? And it's over. The responses from the staff are overwhelming. From our leadership team that has helped me out, to residential staff, to just all sorts of folks have been, yeah, we'll do this for you. And it's been a great thing. We've used it for parades. Actually, our leadership team for Halloween last year, they all got together and dressed up as out of the Scooby times, handing out candy to everybody. It's just been a great, fun thing. It's brought a lot of positive.
The Easter chicken?
The Easter chicken started this whole thing.
Yeah.
Yes.
Well, it makes sense. I mean, that's where eggs come from, right?
Right. There you go.
Well, do you have any questions for me?
So I recently just took the mental health first aid training online.
Awesome.
It was great. I just really enjoyed it. And I think the days that we live in now, it's important for all of us to be aware of mental health. Mm-hmm. In our families, in the streets, and with our, you know, our staff and our individuals here.
That's right.
My thing is, I feel like, what can we do for our staff? Because I feel like we have to take care of the folks that take care of our individuals. So that kind of got me going, what else we do positive things here, but I feel sometimes we just need more.
Sure.
So I was wondering your thoughts on something like that. What can we do? More trainings, more? What's your thoughts on that, Commissioner?
Absolutely. I think, you know, that's important. Awareness will get you so far, and I think everyone needs to be aware. But we've talked about this a lot, you know, because I hear our people y'all are doing the most amazing things around the Commonwealth, saving lives at scale, right? From the 988 crisis delivery system to in the hospitals to, you know, everything that we do. It's mind-boggling how big this agency is and the impact that we're having. But with that comes a great toll. The work that you do carries these heavy burdens, and it's the little moments that make a difference. And I would say, you know, how many of you want to work in a place that's awesome? And, you know, everyone raises their hand. I do. I want to be part of a winning team, all those things. It's up to you to be that person to make that difference. It's being diligent in the little things. So when you come into work and you see your colleague, we pretend that we've got to have this like work-life separation and all these things. You spend more time around at work than you do with your family sometimes. So it's okay to be vulnerable, to share with your colleagues. It's not a place that you just come here just to check a block and go home. As you said, we were talking about, this is a neighborhood, this is a family. Then be like that. And when I say in the little things, right? I've used this analogy before where, I don't know, and forgive me HR, but like, you know, you come in on Friday and it's like, we're gonna have a pizza party. I mean, pizza party cures everything. And I've changed that. It's not necessarily pizza, right? You're trying to say thank you for what you do and all those things in mass. But I've challenged people to think differently in that. So for example, you did a great job today, right? You're tired. You pulled this 12-hour shift or whatever it is, you had a rough day. And when you're getting ready to get in your car, your clock, whatever it is, clocking out, and I come up to you and I give you a pizza on your way home, and I say, I saw you today, right? It's a well-timed pizza. Does it make sense?
Yes.
And so being present for each other in those moments, and seeing, hey, you know, I had to drop my kids off to, you know, this morning, which I did, and then I had a flat tire and I got, you know, baby formula all over me and I get to work, I'm frazzled, and I got to clock in and I got to go right in to be with our individuals. And you see that, and you say, hey, Nelson, you know what? Go chill out for a little while. Let me get this for you. Right? And when we're doing that at scale, like when we talk about I got your back, like that's I got your back. I see you. I'm with you in those moments. So those are important things. Now, again, we can do training, mental health first aid, encourage everyone to take it. Those things are important. But again, I challenge the culture is we all want it. I know you all want it because I want it for you. I want it for everybody. You want it. So then let's make a difference. And that's what this one DBHDS thing is about. It's real. Right?
Yes.
Sorry, I got on my soapbox. You asked.
I did. And thank you for your answers, because I think our staff are very important, you know, and especially boots on the ground in the residential, you know, they're with the individuals 24/7.
That's right.
They don't get a chance to get out a lot. So, yeah, I think it's important, like you said, just the, hey, I saw you today.
That's right.
Here, this is for you. I love to bake. I can't garden, but I bake.
Yeah, so tell me about baking.
So actually I brought some zucchini bread today from our garden for you all to enjoy. But yeah, I will different times just bake something and drop it off at a house, or somebody comes in, hey, here you go. And you see just that 5 minutes of smile. Okay, now I can go on with the rest of the day. Makes them feel good, makes me feel good.
Right.
It's a win-win.
Right. Well, that's what I would say. I challenge leadership. You know, it doesn't matter where you are, who you are. It doesn't even matter if you're not in leadership position. You can be that person, be that change agent, and just make a difference in someone's moment.
Right.
Right. So,
I appreciate you. Thank you
Yes.
for all of you. Thank you, sir.
All right, our next guest is Jennifer Byrd, vocational specialist here at SEVTC, and welcome.
Thank you.
Thanks for joining. Can you tell us, what do you do, and like, what are the individuals that live here, how do they benefit from what you do?
Sure. I'm a day support vocational specialist, and I deal with hands-on activity with the individuals from working on campus and off campus. We do mail pickup and delivery on campus, both in the morning and in the afternoon. We collect recyclable items from shredded paper that need to be processed. We redact bed labels. We collect empty cardboard boxes. We transport those items off campus to recycling centers, getting our individuals in the community, working not just with recycling, but transporting as well. We do seed starts with our Healthy Chesapeake program, where we start seedlings for our community gardens.
Okay.
We deliver those as well, from schools to churches to corrections. We deal with a large, wide variety of activities to keep them involved and engaged with working and employment.
Yeah, that's a lot.
It is.
But essentially, it's providing them like an outlet, like they're physically getting involved in something.
Absolutely.
And then they can see the fruits of that by whether it's through like, I don't know, like, do they get paid?
Absolutely. Yeah. Absolutely. So they do have an hourly wage, and they get paid biweekly. And we also give them an opportunity to sign for their pay. When they receive their pay, it also opens up opportunities and doors for them to money management skills, whether they want to take their money home and save it,
amazing.
Whether they want to get a trip to the vending machine. We even, I'm sure later we'll talk about our person-centered store, where they have an opportunity to see things that they might purchase in the community, but here on campus, whether it's from healthy options, sparkling water, logo socks, action figures, stuffed animals, hats, belts, balls, all kinds of items that, you know, we work hard, we want to see our paycheck, but training them on how, when you get your paycheck, options, healthy options.
Yeah, that's amazing. And for those of you that don't know, when I talked about how these are individual homes, they look and feel like a home that I want to be in. Bedrooms, living room. And so this is like an opportunity for them to really live life.
Absolutely.
And as everyone else gets to.
Absolutely.
Working and buying things.
Absolutely, and it's important to me because I come from residential background. I was introduced to DBHDS where I actually started in food services, and I learned the portion control, the nutritional value of the food, and then I transitioned on to residential, and I've been here for over 8 years now, and I was in the homes for 3 years before I came to day support, and I got a chance to see the dedication residential has to put in for the 24/7 commitment with the individuals from sun up to sundown, overnight, all the needs that the individuals have and their likes and dislikes, to transition that into day support and encouraging them and encouraging the house staff as well with employment with the individuals and their purchasing ability.
Yeah, I hear the words that you're using, and it's really important. You know, if you take note, it's their likes, their dislikes, what they want, their abilities. Like, I hear a lot about the person-centered, and you kind of mentioned. Can you tell me about that, and what does that mean for you and for here? Sure.
Being person-centered, every individual gets an opportunity to have a choice, whether it's their beverage, food, color. We want to give them an opportunity to even have choices on how they want to spend their money. They can request a trip to the Dollar Tree. They can request a trip to McDonald's for ice cream. So being person-centered really is important because being vulnerable with any type of a disability, even myself, I had a medical surgery, and when you're limited to being able to get out and go, limited to your choices, it really plays a lot on your mental health. Mm-hmm. And so giving our individuals a person-centered experience to know that their voice matters, their choice matters, that they can choose, it really, really brings joy to them and joy to us for our why we get up, and our purpose to come here every day is to make it person-centered, to give them some joy in what they can do.
That's so well said. I would say that person-centered is something that we should practice in everyday life, but it gets hard, right?
It does.
How did you learn that? Like, tell me about your journey to get to where you are.
Sure.
I know you briefly touched on it. But
no problem.
Yeah.
I'm a mom of 3, a wife of a chef for over 20 years. So I'm the engine at home, and being the engine at home, making sure that caring for people, caring for others. My 3 children, my oldest son's in the Navy in California. My daughter, she's second year UVA. Yeah, absolutely, go Cavaliers. And then my youngest is in his high school senior year. So definitely being the engine at home, bringing that joy to work and being the engine at work. The journey has really just brought me from, I cared for my great-grandmother who was 106 in my home until she passed at 110. So caring for people has always been.
I'm sorry.
Absolutely, 110.
You got the good genes.
Yes, yes. My husband says all the time I'm gonna outlive him. So I'm investing in my retirement with him working as a chef. You know, we eat well.
I was going to ask, is you know, you hear a saying that chefs don't like cooking at home. Is that true?
Well, he likes cooking at home. He doesn't like to eat his own cooking.
Oh, really?
Yes, yes.
Okay, so you benefit.
I do benefit, yeah. But then I have to pick up the pieces because then it's like, well, now what are you going to eat?
Right. Does he cook and you clean, or is
yes,
it
yes,
split?
yes. I have to collect. I do all the shopping, the cleaning. Yes, and he uses every dish. It makes a big mess. But thank God for my 3 children, so they're very hands-on and helpful with cleaning up.
Yeah. Well, you've got to be a proud mom, and you should be proud of what you do. I mean, that's tremendous. My son's in the Navy too, by the way.
Awesome.
Yeah.
How do you feel coming from a residential background and then dealing with day support, just encouraging our supporting staff all over food service, security, just staying person-centered to help everyone be positive, to to share and to shine the light for all individuals that we service?
It's one of those things, again, I think we all desire to be part of something, especially bigger than yourself, especially what goes on here, I'd say all across the agency. But just, again, seeing each other, pouring into each other, understanding, having, I use the example, you could say the night shift and the day shift. You come in, the night shift's like, oh, the day shift left this for me, and you know, I can't believe this, or they didn't do this documentation, or what have you. But understanding that most people wake up in the morning and they want to do well. You want to do well. Yeah. So seeing each other, being real, and communicating. Humans, we just are not the best at communicating. And that's why we do things like this, right? To share the stories, share your stories so you can hear about what your colleagues are doing. That's why we send out the weekly message to see what's going on throughout the agency, to let you know what you're part of. And so I'd say, how do you know, I would encourage leadership, and leadership, not everybody, DBHDS, one DBHDS, you're part of something tremendous. As a matter of fact, the logo that we have, all those dots that make up that arrow, all those arrows that are moving in one direction, that go from blue to green, all those dots are you and me and our people that we serve. We're all part of this whole journey together. And so it's just recognizing that, and yeah, it's just an awesome thing, right?
It is an awesome thing.
Yeah, what else?
I believe you covered a lot. I mean,
We did.
Like you say, it takes a village, and we all have a positive role to play,
right.
And when we all come together, we make some amazing, great things happen.
That's right. Well, thank you for sharing your time with me.
Absolutely. Thank you for having me.
All right, welcome back. Our next guest is Glen Davies. He's the security supervisor for SEVTC. Excited to hear about this. Also an SCOP, Special Conservator of the Peace. We'll talk about that. So can you tell us, what does security look like here at SEVTC and why it may be different?
Well, security in the hospital, you have mostly general public, but here it's a small miniature neighborhood, and we're not focused mainly on, we're not enforcement. Our main thing is a family atmosphere and making sure everyone feels comfortable, because we have to realize this is their home. And just like us, we want to feel comfortable in our home. We want to feel safe in our home. So we patrol. We do our standard security things. We do our tests. We make sure everything is running properly. But my main mission is to make sure our security staff, they're part of our individuals' lives. Like back when I was a patrolman in a police department, people would see the police and they'd be like, whoa, what did I do? Something's wrong. When I want our individuals to see our security staff, I want them to be excited. They're happy to see them.
Right.
So when our security staff goes through our house, they stay for a while. They talk to the individuals. They hang out with them. They find out what's going on in their lives. And they're part of their family.
Right.
So I think it's better to have someone, it's like community policing. I'd rather have somebody in the middle of the community finding out what's going on, as opposed to just having someone driving in circles. Right. And you're not going to learn anything about the staff or the people. I want everyone together, like a big family.
Yeah, that's well said. By the way, do you pull people over speeding on their golf carts here?
I would love to, but no. It is 10 miles an hour, but I think they think it's only a suggestion.
Oh.
So
Do the golf carts go that fast? You can just put a restrictor on it.
yeah, I would love to. Although they have a radar gun, but those days are long gone.
Okay. Well, with that, I imagine you've got to do some investigations and things like that. What does an investigation look like?
Well, I come from an investigation background. I was a police investigator for almost 10 years.
Okay.
I was in sex crimes, I was in burglary, and then the last part I was the public information officer. But I would rather be an investigator than deal with reporters. Yeah. But again, with an investigations are pretty basic in general. Mm-hmm. You collect the evidence, you gather a report, you have to be very fair. We don't interrogate here, we interview, because I come from the interrogation world. Again, but here it's more of an interview. You want to, again, with everything, you want to get both sides of the story, you want to find out what happened. But we want to come at the end of the day, we want to have a very fair and balanced report. Once everything is put together, we hand everything over to our CEO, over to HR, and then it goes from there.
Okay. Well, hopefully we don't have a lot of those things.
No,
so
we don't.
Harmony here. So that's a good segue into culture. How would you describe the culture here?
Family.
I know
I've worked in many places. I've owned my own business, and this is the only place I've ever worked at where I look forward to coming to work. I think I am here more than I am at home. My wife forgot what I look like, so that's fine. But again, I look forward to being here. I'm here a lot. I'm always around. I'm always doing something. And my staff too. I have staff here that have been here for 40 years. Wow. Some staff for 30. There was one for 10. Some for 8. So again, I have a small department, but we're a family, and we all love being here. Yeah. And I look forward to coming here every day. Sometimes I don't want to leave and go home, but this is, my wife forces me to come home.
What's the commercial when you're here, your family? I'm getting that theme. It's funny. There's something also unique about the agency at large. I would say, I don't know what the percentage is, but there are a lot of people that have served for decades. As a matter of fact, I hear that there's someone that has been here for over 50 years. Yeah. 50 years.
Same job.
Same job. I actually, at Eastern State, I met someone when we were celebrating the 250th year of Eastern State Hospital, by the way, which is what, 2 years older than the United States. There was a young lady who I met. She had been there, and this was again 2 years ago, 50 years. And she was describing to me they would drive the patients into Williamsburg and let the patients off, and they go into town. They just spend the whole day there. I think they called it the gray something. Anyway, they'd start ringing a bell, and then the patients would come back in, get on the bus, and go back in. Like, things have changed, right? We still do little things like that, outings and such, but yeah. I love the culture here, and it is something special. You got any questions for me?
I do.
Oh.
From back I can remember as a patrolman, when we were called to any kind of mental health disturbance, there was a few things we can do. Is there anything legislatively they can do now that can help prevent that in the future from happening again, having to call law enforcement to deal with something that would happen?
Man, this is the topic of my life. Like, we're trying to get these things done yesterday. 988 is our crisis hotline, and it's someone to call, someone to respond, and somewhere to go. And we're actually leading the nation in the build out of this system. And as things are growing, they're new. We learn new things about the system, and how things work. And then you've got to adjust in this area, and there's always an action reaction. But when it comes to law enforcement, our law enforcement partners are out there, and they've got a lot of hats. We talk about people wearing multiple hats, and the last thing they want to do, when they make an ECO, is they want to get that person help, and simultaneously we want to destigmatize, and we encourage people to get help. And this was kind of like, we're evolving. But when you tell someone to get help, they go to a hospital, and then they get handcuffed. It's like, I kind of don't want to help now, right? So that's where 988 comes in, then law enforcement, they're still involved. And so we have, as I mentioned, a special conservators of the peace. I saw this, I learned this a few years ago when I heard about SCOPs. I was like, wait a minute, they can take custody? Because what is it about law enforcement that makes that, they're a valuable resource in their community, right? So SCOPs are specially trained. They have to go through CIT. We see it as a partner in this patient's journey. So we're starting this program. We started in Southwest Virginia. It's been met with rave reviews from law enforcement because they can go transfer custody in an emergency room to an SCOP, who again is part of that care team. And so that's been successful. And then we started a program in northern Winchester, Valley Health. It's a giant hospital. They are taking custody. They hired their own SCOPs, and they're taking custody all on their own, and they're also transporting. So again, we're doing these templates, and we're going to start putting these things everywhere, right? So again, it's going to be a win-win, because we'll say mental illness, someone who, because of their illness, they're trespassing, they break a window, whatever it is, right? They end up with misdemeanors and felonies and land in state hospitals and jails. We're putting pressure valves off the system and destigmatizing, decriminalizing, and again, giving that Virginian the best option and the best outcome. Long answer, but I mean, it's really complex.
Also, when it comes to things that we request, equipment, especially being that I'm an SCOP, I'm here for the worst case scenario. But we would put a request in. Is there anything that we can stay involved in the process up in Richmond that would help push along anything that we might need initially, or even emergency type of situation? Because I don't want to have to wait till something bad would happen. I'd rather be proactive and have everything ready beforehand.
Yeah, that's an excellent question. I think it's something that a lot of folks in our agency need to understand is, in Virginia, we are required to have a balanced budget. So you can imagine, that causes some spicy arguments in Richmond, because everything's important, right? Bridges, schools, law enforcement, everything. And so behavioral health care, so I've got to be the loudest voice in the room, right, to advocate for it. We're competing with, like, I always use the example, JMU gets a new chemistry lab, and then, well, they have a lot of constituents that speak for them, right? We don't, we are the constituents, we're getting a new Central State Hospital. But I would say we listen to your request and, work through your chain of command. You're here. I too don't want to wait till things get bad. But just keep in mind, we're in competition. And then when it comes to our agency itself, everybody, I want you to know, you're part of a multi-billion-dollar company. I mean, our budget is $2.5, almost $3 billion. I mean, it's big. Now, a lot of that's in the community. When it comes to substance abuse, mental health care, like all the CSBs, we fund all those. Within the facilities themselves, we've got to maintain the HVAC systems. We got to make sure that we've got, of course, payroll, but the actual physical plant and infrastructure, food services, I mean, it's a lot, right? We did a security review, and we know that we have a lot of areas that we need to increase and work on those. And all that to say is I am aware of all the shortfalls, and we want to fight as hard as we can to get those resources. I want to first make sure that our HVAC systems and chillers don't break. But stay active, and I'll tell you this. Thank you for asking this. Do the employee engagement survey. I read them. I listen to them. And if I'm listening to them, that means up and down the line, everybody else has to pay attention. We want to know what you're saying. And then I do listening sessions after that. I go around and I listen, and I'll hold town halls. And it should be a you said, we did. You said, we did. And I really, really want to hear what you have to say. So, thank you, sir.
Thank you.
All right.
Yeah.
All right, our next guest is Melissa Bender. She's a residential supervisor here at SEVTC, and we're just catching up, and you're fairly new here, but I'm sure you know what you're doing. Can you tell us what that is?
So as a residential supervisor, basically we run the day-to-day, supporting the individual, supporting staff, working across the disciplines, kind of just juggling the controlled chaos that happens, I guess, is a good way to explain it. And, you know, having a background of 30 years in the field, I've only been here for a year, but 30 years in the field, being a supervisor in residential 24 care is a 24/7, 365 job.
That's right.
You know, you wear a lot of hats.
Yeah. Well, can you tell me, like, for example, like, what are some of the day-to-day, day in the life?
Let's see. Helping to manage the schedule, managing the plans, writing plans, collaborating with the different disciplines to ensure that the individual's care is seamless, holding people accountable, holding myself accountable for things, challenging staff to do better, be better.
It's a big job.
Yeah, it's, you know, there's just all the little things each day that add up to hours and hours on end that, you know, you don't want to change.
I think you're underselling it. I think it's like, I mean, you know, I would say 24/7, 365 is a heavy lift. I mean, these people depend on us to get all these things right every minute of every day.
Absolutely.
And so I imagine making sure those trains coming and going, leaving the station on time it's not a nothing. It's tremendous. From the, as we learned earlier, from the outings to the, you know, washing the clothes, or, you know, every part of this, you know, going into the garden, you know, like, that's amazing. Sorry, I did my homework.
It's okay.
So with that, like, what's your why? Why do you do this?
So it's interesting that you had used the phrase "the little things" earlier, because that is my why.
Okay.
I think anyone that goes into human services does so because they want to help people, they want to bring about change, that kind of stuff. And certainly that's overarching for me, but what resonates and keeps me going and fills my cup each day are the little things. Those little things, those connections that you make each day, the smiles, the little pieces of change that you see in a person, the laughter that you get with staff, camaraderie that you get, just the little details of every day. Human services is hard. 24-hour care is hard, but you find that little piece of good every single day. That's my why.
Good. Yeah, those little moments are something. You call them spark, the little sparks, and they can grow, right? And especially in this field, right? I can't imagine how it must feel to see the joy on their faces, and they completely depend on us, and their families depend on us. So, and thank you all, because this applies to everything we do everywhere. They all, Virginians, depend on us to do this really well. Well, so you've been doing this a long time, and so I imagine you've got thousands of stories, experiences, those moments you mentioned, those little things. Would you mind sharing one or two of those with us?
Sure. Yes, definitely thousands of stories. From my time here, one that stands out is there's an individual that lives in the home I oversee that he doesn't speak a lot. When he does, he likes to say some choice words, which, you know, I find wonderful, you know, him expressing himself. And he was receiving a treatment one day and struggling. He doesn't like to receive this treatment. And he was saying some choice words to the nurse.
Spicy words?
It's a little, spicy, very spicy words. And I walked in and, you know, was trying to help ease the situation a bit. And he paused, and really I could sense that he was trying to say something else, and he really doesn't communicate more than that often. And I asked him to clarify. I said, I can't understand you. I think that you're trying to say something. And he said, I like you. And I was like, gosh, you know, there it is. That's another piece of my why.
Yeah.
And so it's, you know, those little stories that happen all the time that just keep me coming back 30 years.
Yeah. Thank you. Well, do you have any questions for me?
Yes. So you asked me for a story.
Mm-hmm.
What's a story that will resonate for you or resonates for you as commissioner?
Oh boy, I mean, there's so many. I've learned so much. When I took this job, I not even joking, it was probably 80% of this job I had no idea how to do. I didn't even know half the things that we do here, and it's just been tremendous. I guess what resonates is, and I'll tell you, this is true, is that I want to scream from the mountaintops. I want to tell everybody, like all the things, everyone, in my core. I want them to know how much we do here and how I don't think Virginians understand it. You know, these obscure, you know, SCVTC, Piedmont, all the Catawba, VCBR, all the facilities, all of you out there, like, it is truly amazing. Forensics, DD, substance abuse. We do so much in this agency. That's why I'm wholly fixed on this whole, like, one DBHDS. And I would just say, there's so many stories. It's just the people. It's the people that get up every freaking day to do the things that most people don't even understand. And they get on with their lives. And we're driving on the highways, and then you're here doing this. Like, it's, like, I'll never forget that as long as I live. Right.
Well, thank you for sharing that.
Yeah. Anything else?
Yes, actually. In your opinion, what do we need to do as Virginians to improve the services for people with developmental disabilities? Where do we need to go?
Yeah, that's a great question. You know, we've been building this whole system for individuals with DD or ID for the past, I don't know, decade. And I would say Virginia, we have a long way to go, but we have a pretty good system. That doesn't mean that it's not without its faults. I think that what we've done to make sure people live in the least restrictive settings, in homes, in communities, to make sure that they can live their best life, I think it's tremendous. The waivers, we were able to get over $300 million to fill the Priority 1 waiver slots. And for those of you that don't know, Priority 1 means they're going to need these critical services within 1 year. And there was a waiting list. 3,400, over 3,400 individuals on a waiting list, and their families and themselves need the services now. And here we are. That was a lot of money that we put into the system, and hopefully we'll start to see the impacts of what, you know, it takes a long time. I think one of the things we need to do a better job of is bringing in more providers, and that means making sure that people are trained, because we can offer waivers, but that's just like you built a house, there's nothing in it. We need people to take care of the individuals and provide those services. So I think we need to do a better job at recruitment pipeline and training to make sure we have the humans to take care of the humans.
Agreed.
Yeah.
It's hard.
It is so hard, yeah. So that was a great question.
Do you look at what other states are doing, our national associations, other countries?
Oh yeah.
Okay.
We you know, when we came up with our plan, if you're familiar with Right Help Right Now, it was a comprehensive plan to hit the hydraulics of every part of our system. You know, year over year, we've addressed like I don't know, usually it's a reaction to a crisis, something has happened in the community. So a mental health issue, or then we are like, oh, substance abuse, DD. This one hit across the entire system, right? We invested a lot of money. As a matter of fact, in the past, since I've been here, our administration, we've invested almost $1.5 billion. I mean, that's almost some states' budgets, like whole budget. So we came up with Right Help Right Now. What we did was we took national best practices. We looked at other states and what they're doing. And you know, we want to be best in class. So we took the best of what they were doing, and honestly, Virginia's leading the nation in many fronts. So to answer your question, yes, we did, but I think most states are looking at what we're doing now.
Okay. Well, thank you. I think
Yes. Thanks for joining.
all right.
All right. Well, welcome back. I'm joined by Anisha Walker, residential Hello. Welcome.
Thank you.
Residential supervisor
Yes,
at SEVTC.
correct.
All right. That's a big title.
It is.
How long you been here?
I've had a split time here. Initially, I worked here from 2007 to 2010, and then I relocated to Richmond, Virginia.
Mm-hmm.
I came back in September of 2023, and I've been here ever since.
You say relocated to Richmond, like it was in like a completely new place.
Oh, well.
I just
It was
came
for
from
me.
there. Like it was like.
Yeah, it was for me.
I know, it's funny. I get travel all over the place, and it's like I'm the person from Richmond. So, in your role, I've learned so much in this job. You deal with individuals that have a range of different things. Like, how do you manage that?
I believe that because our individuals vary in cognitive function, physical capabilities, medical needs, we focus on specific things. Safety is definitely one of the things that we focus on with our individuals, just making sure that the activities that they participate in are safe for them, the environment that they live in is safe for them, things that we do regarding like medication, things like that,
Sure.
making sure that we are practicing safely for them. Safety is a big issue for us to pay attention to. We also meet the need of quality care. We provide quality care for our individuals, making sure that they have what they need throughout the day, making sure they have the choice to make decisions on what they want to eat, what they want to wear,
Right.
what they want to watch on television, things like that. The intricacies we pay attention to.
Yeah.
We also provide compassion for our individuals. I read somewhere that we're supposed to get at least 8 hugs a day, you know, and we do try to do that for our individuals. We give hugs. You know, we pay attention to when they're not having such a great day.
Yeah.
You know, we try to meet them where they are with that, help them come out of that mood and into a better mood. And we just provide community for them. It's important for them to know that they have support everywhere they go.
Yeah.
And for some of our individuals, we're the only family that they know.
Right.
So we really try to rise to the occasion and make sure that they have a full sense of community out here at Southeastern.
You know, I've heard that, especially in this line of work, compassion fatigue is a thing. Like, how do you keep your team from getting to that point? I mean, I can't imagine day in, day out that might wear, you know, you do all the same stuff and you get burned out. Well, how do you manage that?
Well, I remind my staff that we are all human and sometimes you need a break. So communicating that is important.
Mm-hmm.
Hey, I need 5 minutes. You know, it's teamwork.
Right.
So someone takes 5 minutes, someone else steps in you know, we work together to make sure that we are good. And I always do a climate check for my staff just to make sure, hey, how you doing? Everything okay? And my door is always open if they need to talk or if they need to process something, you know, or if they have just questions.
Yeah. Well, I'm glad to hear that. That's like we were talking about that earlier, is seeing each other.
Yeah,
right?
absolutely.
In those little moments. There are like thousands of books on leadership, right? If leadership were something that we're all born with, then there wouldn't be 1,000 different books, right? It's like
Indeed.
flavors of ice cream. How would you describe, like, what is a good leader to you, and how do you help other people get to that point?
A good leader for me is someone who listens. Listens to what is being said and also listens to what's not being said. A good leader.
Can you say more about that?
Sure. Sometimes people will say things that they think you might want to hear, but their demeanor is giving you something different,
Okay.
or you know, just their gestures might be saying something different. So it's just important to pay attention to the whole person.
Sure.
And ask questions, you know, just to make sure that what's being said is the actual truth of
Right.
how they're feeling.
Okay.
To me, also, a leader is somebody who knows how to navigate situations properly and effectively. Remaining calm in the midst of chaos. It is definitely a skill that needs to be learned if you're going to lead a team. Also, knowing how to follow. I think that's a definite strong point of an actual leader, because you can't be in the front all the time.
That's right.
And if you maintain a posture of learning, I think that makes someone an effective leader. If you're always in a posture to be teachable, I think.
Yeah, right. It's, you know, the old saying, in order to be a good leader, you gotta first learn to be a good follower.
Absolutely.
Very wise words. So everyone remember that. There's a theme that I'm picking up with all of these conversations. Being diligent, being paying attention to the small things, being present, listening. I mean, this is really, really good. What do you got for me?
So, I'm a policy person, so I would love to know the latest about the DBHDS strategic plan. Like, are we meeting goals? Where are we headed?
I am not a policy person. I just dress like one.
Policies are good.
No, it's good. Thank you for asking. I'm glad to know you're paying attention.
Yes.
The strategic plans, you know, we set a course 3.5 years ago to, the whole goal is, you know, as our motto says, to create a life of possibilities. So in order to do that, if you start from that goal and you work backwards, we have to have some benchmarks and milestones, right? To make sure that Virginians have the best quality behavioral health and developmental disability care that we can offer, right? And so yes, we have the right help right now in our strategic plan. And I would say that we have accomplished we hit all our goals that we set out to hit in our very first wave of our strategic plan. And we've been updating them, right? So you can check out our website. It lives on DBHDS website, so you can check it out. We meet about it. As a matter of fact, this week I took the executive team to an off-site location, and we talked about setting a new strategy. Because again, we've, you know, from increasing peer supports in Virginia, we set a target. We've exceeded that goal. From the crisis build out, the number of beds and chairs that we have in Virginia, we're on target to hit those. Mobile crisis teams that can respond to any Virginian in less than an hour, we've exceeded that goal. To We set a target to reduce opioid-related deaths, fentanyl-related deaths in Virginia by 20%. We've exceeded that. We're actually #1 in the nation, 43% reduction. I mean, tremendous. And that's a whole of, it wasn't just us. I mean, there's a whole lot of things. So, I mean, we're just so proud of all the goals. And then within the facility services itself, we set goals for, you know, patient aggression reduction, peer-on-peer violence, to workman's compensation claims. We don't want our staff getting hurt. That means we've got to focus on clinical outcomes, making sure that patients aren't bored, that we've got activities to make sure that everyone's involved and knows what that clinical plan is, right?
Absolutely.
So with that, we're going into a new phase, and what we're considering is, for me, it's setting a strategy of, I'm starting with what does a perfect behavioral health care and developmental disability system look like? That every Virginian knows. It's not just like you got to call somebody and say, hey, my cousin or my friend or me, I need help. So behavioral health care, healthcare literacy is hard by itself, but behavioral health care literacy is even harder. The entry point is the emergency rooms. Now we have our 988 hotline, and everyone should know that. So it's going to be that Virginians can have the care they need and know what it is, because a lot of people don't know. They're like, my child has this issue, and you say, well, go to the website. An example is I've been using is, what is TDT? I don't know what therapeutic date. I don't even know what that is. Here are my kids' symptoms. You know what I mean? Like, so we've got to make that care understood, accessible, 24/7, 365. So we're starting with that, and then backwards. All right, where do we need to be better? What kind of resources do we need to make that happen? And so, yeah, we've done a tremendous amount of work within the facilities and in the community, and there's still, I mean, you know, we will never stop fighting to make sure that that goal, that perfect system, right? That's the goal.
That's awesome.
Thanks for asking.
You're welcome.
Yeah.
Okay, so now I have another question.
Okay.
So I know that skilled nursing services are coming here to Southeastern.
Mm-hmm.
Where are we in those plans? How does it impact us?
Well, I'm sure you started to feel it here, and hopefully it's a positive thing. I think what we're talking about is we're going to be bringing a level of care to SCVTC that I think will benefit all the residents here, because this is their home, and as they age, their medical issues are getting more complex. Okay. So we're trying to match that, and we want to make sure that the people here, you all have the skills that you need. So we want to send everyone to get the training required to become a skilled nursing facility. And so there are a couple of homes that we're going to renovate to be able to match that level of care when it comes to, like, you know, the medical wall, you know, with oxygen tanks and all these other things that may be needed. Simultaneously, I know that you're working hard here to get the staff into the training or hiring staff that have those skills already. And so it's going to be, the timing is good. And we did that intentionally, right? To make sure that while we're building, you know, getting all this stuff ready, that we're going to be bringing our staff up and getting them ready too.
Okay.
Yeah. Great
Awesome.
question.
Thank you. That's all I had.
Well, it's been a pleasure.
Indeed.
Yes.
Pleasure's all mine.
Thank you. Well, hello, sir.
Well, how are you doing, Commissioner?
I'm okay. How are you?
All right.
Well, let's start. What's your name?
My name's Daryl Pleasant.
Daryl Pleasant. Nelson Smith. All right. So what do you do here at SCVTC?
I'm one of the physical therapist assistants here from the rehab department that goes out, and we're trying to make sure that the individuals maintain some type of mobility and function of life. So that's what I do here.
That is a huge job here.
Right, right.
Yeah, and so do you see all the individuals?
Between my counterpart, I've got another physical therapist assistant here, Michelle Ellis. We kind of split the houses up between us both. So
okay.
That's how that works.
Yeah, that's a really important job. I mean, I don't thank you for what you do.
I appreciate it. Appreciate
Because
it.
a lot of the folks, they, especially the ones that are non-ambulatory, right? They need
Right.
that help to keep the
Right.
muscles going.
Right.
Yeah. So how long you been here?
It's going on 3 years now. I left a skilled nursing facility that I had been at for 17 years to come here. The reason that I did that was because where I was at, it was more driven towards insurance than the help for the patients themselves. When I came here, it's more driven towards the individual, which I like a lot. You can give them the type of care that they really need.
Thank you for saying that. Did y'all hear that? That's everybody. You guys are doing real work,
Yes,
meaningful
yes.
work.
Yes, yes,
So
yes.
thanks
yes.
for joining the team. What's the most striking thing that you see here in this place that you haven't seen elsewhere?
How everybody comes together as far as staff to make sure that everybody's taken care of, well taken care of. I was astounded the way that they document the care here. For instance, any minute little things that happens with these individuals, it is documented to make sure they're well taken care of.
That's awesome. So I'm like, documentation is,
Right.
a lot of people don't understand it. It's like, it's kind of annoying, but it's how we tell the story of what,
Right,
and
right,
highlight all of
right.
it. And you mentioned that you were coming from the military
Yes,
before?
I spent 21 years in the Navy, came to Virginia, retired here, went to school for physical therapy assistant, and I've been here ever since 1993.
And what drew you from what you were doing in the Navy into what you're doing now?
When I did retire, I was working at a gym, and I became a supervisor. And I kind of like, well, I became a certified trainer, and I like this. I'd like to do something that helps people.
Right.
And what I found closer to it was physical therapy assistant. So that's what drove me towards that.
And this population?
And this population, I'm gonna tell you honestly, what happened, how I got here was a young lady that used to work with me at the skilled nursing facility. She's here now. She's a Coda, Sherry Hughes. She kept coming back, man, we need you there. You got the personality, you'd be great, you'd be great, you'd be great, you'd be great. And I finally came over and I talked to the person that was in charge of the rehab department at the time. And they had some individuals in what we call our multi-purpose room, and they were working with them. And she sat back, and I was just talking to them. I was just being myself. And she's like, you'll be good here. You'll be good for these individuals. And once I got here, it was a fit. It was just a perfect fit.
Yeah. That's what I know about this place too, is the people that work here, the homes that I visited, they make it like home.
Right.
Everybody comes together.
Right.
Well, you have any questions for me?
Not really. I think, like I said, we talked about the things. I think we just need to continue doing what we're doing, making sure that everybody's taken care of. Legislation is working towards this type of population. Sometimes they get kicked on the back burner. So we want to make sure that they stay in front.
Yeah, that's my job, is to make sure that we advocate for the whole system, but specifically, what's going on here.
Right. Right.
What is it about this culture? Now, I get you see, like, I just briefly got to know this gentleman, and I feel like I want to work with you.
Okay.
And that's really important. Culture eats strategy for breakfast. What is it about this culture that keeps you coming back? You said that since you've been here, you love it. Like, what is it at?
Personally, it's the individuals, getting to know the individuals and to watch them and to work with them and see their response to when you're working with them. That's what I like. Like I said, I came from a place where you couldn't give that type of care that you wanted to give because everything was insurance driven. Here, you can give that type of care, and you appreciate coming to work every day, seeing the response from the individuals themselves.
Yeah. All right.
All
Well,
right.
thank you, sir, and thank you for what you do.
Thank you.
Yeah.
Take care.
Yeah.
Nice meeting you.
All right. Now I'm being joined by Zaldy Ancheta, professional instructor extraordinaire. Is that right?
Yes,
And
we'll
then
say
some.
yes.
And then
Yes,
some.
yes.
Well, first of all, how long have you been here?
I've been here since 1998. I started off in food services. Had the opportunity to work direct support Did that for a number of years. Got into medical records, managed that for a while. Security supervisor, administrator on duty, and now I'm finally here in staff training.
Okay.
Yeah.
So a lot of depth and breadth of
Moving around,
the
yes.
whole thing.
Yeah.
That's amazing. So when it comes to the training and getting people in the door, what are some of the things that you want them to know up front? Like what trainings are important?
Well, we do have a curriculum. That's kind of obvious, but we try to encourage them to kind of understand how important their purpose is here. First of all, we kind of encourage them that, you know, for you to even come here to Southeastern is very special, because it takes a certain type of person to be able to do the kind of work that we do. And then we remind them that what you're doing is important, not just for yourself, but for the people that you're going to be impacting through your service and support, particularly our individuals.
Right.
So we do that. And, you know, being in the experience that I've had with here in Southeastern, with all the insight that I've picked up over the years, I kind of try to imply you're going to have some rough days.
Right.
And there are certain things that I've learned that kind of help you with getting through those days. And it's always going back to your basics, you know, basic training, your basic purpose, and realizing that even if you don't see the rewards of what you're expecting necessarily, that you have to realize every little thing that you do, as long as you're consistent and your intentions are well, you're really making a great impact for the people that we support here.
Yeah.
Yeah.
That's I would say that's a hard thing to do, is to get folks to understand that. It's the long game,
Mm-hmm.
right? And there's a theme you've been hearing here, the details, the little things, the small things, the
Mm-hmm.
small moments. Those things add up over time.
Mm-hmm.
I used to say or desire the same thing when I worked in inpatient settings, doing the new employee orientation. It's like getting people to understand, like, you know, that it is hard emotionally sometimes. It's getting people to understand, like, firefighters, you know that you're going to have to go into a fire. You know what I mean? Like, knowing the hazards of your profession, but then still maintaining, you know, that can-do attitude the whole time. It's hard.
Yes,
It's a hard lift.
yes.
Is that kind of what you're?
Yeah.
Yeah.
Yes, absolutely. And, you know, and we do it through sharing our own experiences. In fact, when we graduate the new employees to start working in their departments, we kind of have people join us and they share their own bits of wisdom.
Yeah.
Because, you know, different perspective, different personalities. We want to give them as much as we can give them to be successful out here. Not just with the curriculum that we do, but even the personal touches. And that's another thing we try to get to know, even up front when the people come in, get to know more of who they are. Why did you apply and want to work here at Southeastern?
Right.
And kind of cater our training to that.
Right.
To make it more impactful for them and more meaningful for, okay, they're just not training us just to train us, to feed us information, but how am I going to actually apply this out here to make it and own it for myself?
Yeah. That's where I'm harping on this one DBHDS thing, but the reality is that your experience is a great example of that. To go from, you can be on the front line, DSA, or you could be food service, or you can be in medical records. You go onto the unit to go pick up records or do something else, and you have a moment, whether it's with other staff or whether it's with the individuals. And that moment's, like, those are real. You say hello. Maybe they were feeling down, they haven't talked to anybody, you say hello. Mm-hmm. Or you're there to, you know, clean something. Like, everybody is part of this.
Yes.
It's really, really kind of cool.
Yep.
So what do you do to make the training engaging or fun? Do you have a secret sauce?
Well, I think the most basic principle is get to know the staff that are coming in. We have an icebreaker where, you know, we do the standard, what's your name, what department are you going into?
Sure.
give us a fun fact about yourself. And then we have an icebreaker where there's this little ball that has a ton of questions on it. Kind of toss that around, answer the question that's on there. So it gives us a little insight on this person's personality, what their interests are. And even then, throughout the orientation, at least for myself and my coworkers in there, we're like talking to them individually throughout. You know, if there's something that seems like we have something in common, or even not, we kind of touch base with that. And again, that kind of helps us with what's the best way to teach this person or to instruct them. Some learn by listening, some can read, you know, they need to read something, others are hands-on.
Right.
So having that bit of insight helps us with that aspect.
Right.
And we forward that to the supervisors. So we're kind of setting up ahead of time, even when you go in your new department, whatever welcoming process that we have here, and you'll hear it from the feedback. We have this survey that we ask them, how do you think about our training? And it's almost consistently, we feel welcome, we love the instructors, we feel, and we want to extend that even into their own departments. So
Right.
whatever we learn, we share with our supervisors that are, you know, going to be receiving. And that's the idea. We just, you know, you come, you're welcome. Oh, and I try to tell the new people when they come in that just because you're joining us, whatever you're bringing with yourself, that's what it is. Whatever experiences you've had, whatever knowledge base that you've come in with,
Love that.
we are appreciative, or we really welcome that, because you're going to add to what we already have.
That's right.
If we've got top-notch service now, how much more with you bringing what you come in with, and you're going to help us make this even a better place than even your first day of work here.
That's right.
Yeah.
I love that. I absolutely subscribe to that. A very wise person taught me something a long time ago. He spoke in these like euphemisms, you know, like you have to figure out what it means sometimes, or parables, but it was like, dance with the person you brought to the ball. And what he meant was, like, you can't make up, don't try to look around and find new things or try to create, you know, someone else. Like, bring your strengths, your background, your that's what makes it interesting, is you've got a different experience than I have. But your strengths are going to complement mine, and together we're all dancing.
Yeah.
Like, it's kind of cool.
Exactly.
I love that you have that here. Thank you. Well, I heard that you were unfortunately in the Navy. I mean, sorry, you were in the Navy. I was the Army. You know, I know that I brought a lot. I think the military does a good job at helping with soft skills, which are those skills that sometimes are hard to teach, and I took for granted for a long time. But I know that I brought a lot of that with me. How about you?
Yes. So when I first joined the military, I was basically a mama's boy thrown into independence. And I want to say, as far as my independence, it was the military that gave me the room to really grow into that. And some of the things that I picked up in there is, you can always look for the information you need, no matter where, because you're not going to know everything right away. So that's one, that skill set. Two, you're working with so many different types of people. You're going to have to adapt to that, in a sense. Make room for, you know, the differences and things like that. And third is the discipline. The discipline of doing things that has to be done, but you don't really want to do. But it's important that you do it.
Right.
So you just get in there. And the one that I miss most about the military, I would say, is the camaraderie. The idea that you go in as an individual and you're built in to be part of a unit, and whatever little action I do is going to affect whatever your purpose is. And even if I have little areas where I need support, you're going to be that guy to help support me there. And I'm going to return the same thing, no questions asked.
Right.
And even here, I try to emulate that. Even my own department. And another thing you learn in the military is you show by example. So that's another kind of, bring some of those principles into where I'm working, and hopefully people pick it up and
That's
then
right.
get it working in there. And so far we've got a great team. Things happen. we're like, okay, what are we doing? And we figure things out.
Right.
Things are like, most people, you'd be stunned, like, what do we do? Not this team, it's,
Right.
And so, yeah, the military's really contributed to a lot who I am today.
Yeah. I love what you're saying. So you get what we're trying to do here with this cultural thing, right? You talk about, I used to think a lot about, like, what was it that my team or those individuals I served with were willing to do. What we were, I was a Green Beret, so why were those people willing to do that? It wasn't for pay, that's for sure.
Yes,
like,
yes.
definitely not for that. And it was, I could just boil it down to being part of something bigger than yourself, and knowing that you're well trained and you have each other's back, right? So then how do we bring that here? And how do we do that at scale? And so we've been working on that. I would challenge everybody, like you mentioned, again, we talk about the details, but also sort of like an accountability. It's what you do when no one's looking, right? And even when I don't want to do it, I'm like, ooh, you know what? I challenge myself every time, right? And so that's when we get to that place that you're describing here. So when everyone is doing those little things at scale, that's when we have that. We've got that juice. We got it, right? So thank you for describing it in that. I mean, you're more articulate than I am. But do you have any questions for me?
Do I have any questions? Well, the easy one that comes to the top of my head, what do you do for your spare time? I mean, what fun things do you?
Oh, man. I have 4 little kids. I have twin 8-year-old girls. I have a 5-year-old boy and a 3-year-old boy. And so, as soon as I get home, it's dad mode. But that is fun. I mean, riding bicycles to, we're doing, they're in jiu-jitsu.
Oh,
So
wow.
that's, twice a week. We're starting school now, so soccer's about to be on, ballet. But I've been reading a lot. I actually just picked up Demon Copperhead, great book, especially about what we do, substance use, opioid. So yeah, I like to read. Work out. I go work out every day.
That's good.
Yeah.
Yeah,
So, which is part of mental fitness, physical fitness.
definitely.
Yeah.
Yeah, I can relate with a lot. I have a 12-year-old myself, and
Okay.
biking, when you said biking, I was like, yeah, I love that.
My 3-year-old's got the little, not, the one with the, what is it called? The glide bike or something, no pedals.
Yeah, I used to do my friend here, Joel Josen, the nursing director, when we were much younger, we would do 30-mile rides at night because we used to live close to each other, and we would do that. Nowadays, it's not as easy, so we invest in e-bikes. I mean, so we're doing that now. Is it common to see staff hold multiple roles from what you've seen in other facilities?
Yes. I'm laughing because some of you out there are like, yes, I have 15 hats on. I would say yes, that is normal. And that's what I think is unique too about each facility and each department is that people pick up their share and then some, right? I talked about before the burdens that we carry. And so, yeah, I definitely see that. I don't think, you could say, well, we're understaffed. Like, I don't know a place that isn't understaffed. But how do we make it work? And that's the cool thing. What you were talking about before is I've got your back. Let's pull in there and do this. I think that is a special thing that I've seen in this agency, in almost every department, right? Mm-hmm. Now we want everyone to be fully staffed. I mean, that's our goal. I mean, actually on our strategic plan. But yes, there are lots of people wearing multiple hats.
Well, I enjoyed my time talking to you.
Same.
Yeah.
I love your energy. I feel very calm.
I appreciate it. Thank you.
Thanks. All right, now is time for one of my favorite things, Thankful Thursday. You know what that is, right?
Yes, sir.
All right, let's see what happens.
All right.
Was that smooth? All right, we're going to draw a name. And I want you to know, folks, thank you for your engagement on this. We are just getting so many of you that are just screaming to highlight your coworkers. That just tells me that you're all paying attention to each other and you are there for each other. So thank you. We are one DBHDS. All right, let's see who wins. Well, you all win, but there's only one today. Maybe a dozen. All right. Anzella Sampson, AOS Building 2. Thank you for taking the time to make sure our patients receive the supplies they need and assuring the nurses have the materials and supplies they need. You are seen covering many units. And that's all caps, many units, with the minimum amount of help, and I applaud you for your dedication, patience, and hard work. Keep up the great work, and thank you for all you do. Well, congratulations. This is awesome, right?
Absolutely.
Well, thank you all for paying attention and watching this video today. Hopefully you found and learned something new. I know we talked about it. We all learned something new today. And that's the point of this, is so we know what everyone else is doing around this great agency. Thank you all for joining me. This has been really fantastic. Heather Fisher, the CEO of SEVTC. The culture is strong here. That's what I heard. And we're just so thankful for all that you do. So let's finish strong. Bring it in. Oh yeah, on 3. 1, 2, 3, 1 DBHDS.